Hello.
Me just live inside one room now.
She was my only daughter among 3 boys. She has this personality that's, it's contagious.
Fern Napwat's 13-year-old daughter Tidri, known to her family as Nikki, loved flowers and her friends and family. But Nikki's life was upended in June 2025.
She told me, Mom, there's some sort of bruises in her mouth, and then there was a big red dot inside her eye.
An early morning trip to Vanuatu National Hospital found her blood at critically low platelet levels. After hours of waiting, Fern was told Nikki needed a blood transfusion, but there was no blood in the blood bank.
I was really frustrated, upset, and I told her, okay, we came first thing in the morning. You could have done this in the morning.
Nikki's family mobilized to donate blood. And once she began transfusions, doctors said they began tests to find a diagnosis. That included an analysis of Nikki's bone marrow, often used to diagnose leukemia. Fern says she was initially told it could be analyzed in Port Vila, but days later it was revealed the sample had been sent to Australia.
It took weeks. And then during that period, my daughter was getting, sick every time.
Despite the delays, Fern says doctors reassured her.
Every time when we asked the doctors if, going overseas was an option, they'll be like, no, we can fix this.
But that never eventuated. After around 3 months of treatment, they told Fern Nikki had an infection and her treatment options had run out.
She told me that her body is not responding to it. And then there's nothing else that they can do for her.
Deciding she had to do whatever it took to try and save her daughter, Fern took Nikki to a hospital in Haryana, India, where she was quickly diagnosed with leukemia. She was also told Nikki had hepatitis B, which Fern suspects may have come from the blood transfusions, though the source has not been confirmed.
The blood test had shown that it was introduced into her body. And they asked me if she was getting blood transfusions back in Vanuatu, and I told them yes, she had. It was one thing that really contributed to the aggressiveness of the leukemia.
Despite chemotherapy, after just a few weeks, doctors told Fern for a second time that there was nothing they could do to save her daughter.
That was the last time she looked at me. So that was when I lost her. It's an experience where you will never want to go through. You don't want to eat, you don't want to think, you don't want to wake up. And the fact that you're alone, it's indescribable.
Fern now faced the grueling task of getting her daughter's body home. With donations from family and friends, Fern says she spent nearly 100,000 Australian dollars on treatment and repatriation. And while she understands the challenges facing Vanuatu's health system, Fern believes the urgency of her daughter's condition was never prioritized.
I actually took my very sick child to the hospital with the belief that, once the doctor sees her and then is able to tell me she is sick and this is what it's called and then this is the treatment.
Do you think your daughter would still be alive if she had gotten the treatment she needed?
Yes.
I've come to Vanuatu National Hospital to meet Dr. Sale Voroparafu.
Our biggest challenge at the moment in Vanuatu is lack of manpower. I think we're sitting at 40 or 50% capacity. And at the hospital, it's used for 500 nurses. And within the system, we probably need 300 doctors. So it's like the saying, a table cannot function without 4 legs. And currently we only have a table with 2 legs to run a service. So it's a very shaky and wobbly table.
He says understaffing has led to huge pressure on specialists.
There's 2 of us, but there should be 5 specialists. So we can take turn doing night shifts. There's issues like burnout, sleep deprivation, having to deal with a big workload. These experiences are shared amongst all the healthcare workers. You can have a brand new AUSAID-funded health center, 20 million Vanuatu, all the latest equipment. But if you don't have that healthcare worker, it's just like a museum.
For the Vanuatu's Acting Director General of Health, Dr. Santos Wari, he concedes doctors needed to do better in Nikki's case.
So that means if they don't have the capacity to do diagnosis, is it their responsibility to communicate that to the patients?
We can't compromise. I mean, the safe game is if I cannot do it, it's important. I say I can't do it.
In Nikki's case, will there be an investigation into her case?
I won't know. I mean, maybe there will be an investigation. I won't know. I mean, that's a possibility.
However, he agrees staff shortages and a lack of reliable medical record keeping have left healthcare here wanting.
I know in Vanuatu, our expectation is high, and that's all right. In fact, we have a lot more work to do to meet those expectations.
Dr. Wari says he hopes a new cancer treatment center to be built by the end of the year will form part of that work.
We are very ambitious to make sure those gaps, big gaps in knowledge and skills, we narrow it down.
So this is her room.
For Fern and her family, the reality of life without Nikki is still sinking in. But the family is determined to ensure her death wasn't in vain.
The experience that I went through, that my family went through, we wanted to change, to be able to assist families, children who may be going through, having the same type of sick, but then they don't have the financial support.
In the future, she hopes to be able to improve the outlook for children like Nikki.
I'm not going to accept another child who's going to die from this disease. That's why I believe that we should do something.